Posterior to anterior glides, or PA glides, have been advocated for facet joint dysfunction as well as radiographic instability in the lumbar spine. Here's how you perform the technique. Ideally, the patient is on a table. Having them on the floor like this can give you better leverage. But one thing you want to be cautious of about that for somebody that's having pain. Regardless of how you do it, is you want to get your purchase and you want to keep your elbow straight and then your shoulder up over your elbow. So your line of force is going not only through your forearm, which we usually recommend, but going through your humerus as well. And this way you can provide a lot of leverage and a lot of force if you need to. The purchase, there's different types of ways to get a purchase. This is the pisiform purchase, where the just distal to the pisiform is contacting the spinous process and the lumbar spine on a respective level. And then you check for joint play, you check for infill, you check for muscle guarding, and you're just assessing how well does it move as well as does it reproduce their pain. Be careful about getting into amount of movement and muscle guarding and those kinds of concepts versus pain reproduction, because it's very unreliable to determine extent of movement and the extent of muscle guarding. Here's a close-up. So again, you get your purchase. The line of force is shown as the arrow. So again, this is a pisiform contact. I like to utilize my thumb to reinforce where my purchase is. And so this is where my purchase is. This is where the force is going. And just distal to the pisiform is contacting the central portion of the spinous process of the level I'm assessing and or treating. These are treatment techniques as well. And so just take up the slack. So you're going to take up the soft tissue slack, compress to the soft tissue slack, and then check for joint play, and then do your grades. The diagnostic accuracy for facet joint dysfunction is really limited. There is some evidence that is highly specific if the PAs are negative to help rule in radiographic instability. In other words, if you do a PA and it lacks hypomobility, that can help rule in radiographic instability. But again, remember before I mentioned determining hypomobility is challenging at best. Now, in these studies, they use flexion extension radiographs, and before I've mentioned about too is radiographic instability is a diagnosis that is controversial. But if you look at the value here is you have a moderate shift in pre to post test probability if you have negative hypomobility to help rule in radiographic instability, and then you really have an inconclusive or rarely important shift if the test is negative. A lack of hypomobility can help with the potential for diagnosis of radiographic instability. And again, remember the caution with that diagnosis. I hope you found this helpful. Take care.